Hi, my name is Carissa. I'm 16 days post-op from having a lumbar laminectomy microdiscectomy. My doctor was Dr. Mark Tantorsky at Penn Medicine in Westchester, Pennsylvania. A little bit of my backstory. I'm 25. When I injured myself, I was a mother of 6. I found out I was pregnant. I had fallen down some stairs and thought that I had hurt my back. They couldn't do anything for me, sent me home, told me to take some Tylenol. When I was about 7 months pregnant, I started to have leg pain shooting down my leg. Couldn't walk, was taking showers, sitting in a chair, couldn't walk to the bathroom without having to squat down. If I went to Walmart or Target, I couldn't walk. I was the girl that was sitting in the little go-kart trying to get around the store and get things done. I was crawling on all fours, trying to clean up my house, sitting in a chair to cook dinner. There was points where I just got to the point where I was just like, I can't do this anymore. They told me that there was nothing that they could do for me until after I had the baby. I had the baby in November 2014. About 2.5 weeks after I had the baby, the pain didn't go away, so I went back to my doctor. She gave me naproxen, no, gabapentin, that's what she gave me. She sent me home, and here you go. And I went back, and I was like, this isn't working, and she put me on a steroid, and that didn't work, and then I went back again, and she put me on another steroid, and that didn't work, and so finally, I told her, I'm like, I'm losing sensation in my leg. I was like, it's getting worse. The pain's getting worse. And I said, and you just keep sending me home with steroids that aren't working, and it's not working. I'm not inflamed. I hurt myself when I fell down those stairs. So finally, she sent me to an orthopedic doctor. I had an MRI done. I had herniated my L5S1. I had 3 fragments that were pushing up against my nerve. Dr. Schaefer was the orthopedic doctor that I had seen, and he had done an epidural on me. The epidural didn't work. I waited about 3 weeks after I had the epidural, and finally they had told me that I could either get another epidural or I could go and see an orthopedic surgeon. So I, a little bit apprehensive, didn't feel comfortable doing the surgery, but I knew that the epidural wasn't going to work for me. If it hadn't worked the first time, it wasn't going to work the second time. I was getting worse, starting to become bedbound, getting depressed, on all these medications. Hated taking the medications. They were making me feel weird. I didn't like it. So I went and saw Dr. Mark Tantorsky. He came in, told me that I had herniated my L4, my L5S1. On my L5 was the one that he was concerned about. It was about 11 by 22 on the left side and 9 by 20 on the right, herniated. And I had 3 fragments pushing on my nerves. And so he recommended that I get the surgery. He told me pros and cons, kind of, I don't know, I was just a little bit not comfortable with it. My mom had gone through it. I had seen how she had done it. I was really nervous about the healing process. Where we moved, we're a military family, so I didn't have a lot of family or friends where we were because we just currently moved from California to Pennsylvania. I don't know. And he kind of, told me you'll be better. And so I talked to my husband, and next thing I know, a week later, I was having the surgery. Really nervous, I don't know. I went in there, had the surgery. When I woke up, I was in a lot of pain. Majority of my pain before the surgery was in my leg and not my back. So when I woke up and the pain was in my back, I thought to myself, what did you do to yourself? What did you do? This is insane. The pain was just horrible. Yeah, I was regretting having the surgery because of how much pain that I was in, because before I had no back pain. So I guess for those that you have the back pain, I never experienced it. I just had the leg pain. And it freaked me out. So after I had the surgery and I was in the pre-op, and they wanted me to roll over and check check my back and see if I had any leakage, and I didn't. And they wanted me to go to the bathroom, and that took me about an hour to work myself up to go and be like, okay, I can roll over, let's do this, and let's get to the bathroom. Pretty painful walking. I felt a little bit wobbly, disconnected, just not myself. Finally got my pain under control. Used the restroom, they discharged me. I drove home. When I got home, I had to walk up some stairs. That was very painful. I laid in bed and I didn't want to get back up. I just was not mentally prepared for the pain. The medicine I felt wasn't working. But definitely the first couple of days were pretty hard for me. I finally got my pain under control. About a week after the surgery, I went from not really doing much, but from laying in bed to actually being able to get up and walk around the room. I felt if I was active and getting up and walking and sitting versus laying down, my pain was more manageable than if I was laying down. I felt like I was in more pain, that I was doing worse for my body than I was if I was actually getting up and doing something. So I started to get up more. I'm now 16 days. I'm walking up and down my stairs. I'm cooking dinner. I go to the grocery store, but I bring kids with me to push the cart because I won't push the cart because I'm not supposed to. I'm taking showers standing up. I'm walking around the house. I'm driving my car, just to and from the store. I mean, I absolutely am so happy that I got the surgery. A few things that I would recommend for people that are getting the surgery is go shopping for groceries before you have the surgery. Maybe purchase some of these bandages to put over your incision. Definitely buy some stool softeners because you do not want to get constipated when you have this surgery, or after the surgery, I mean, because from what I understand on the paperwork, it can actually re-herniate you. I recommend putting your towels up on the bathroom counter. Any kinds of soaps, lotions, put it on the counter, deodorants on the counter. Washing your clothes, make sure that they're folded and put on top of your dresser versus sticking them in your drawer. I bought a gripper thing that's at Walmart for $9, and that way I don't have to bend over and I could pick up little things here and there around the house that the kids drop, and you know, motherly me wants to bend over and pick it up. It's actually saved my life. I'm doing laundry with it. I grab the laundry out and stick it in the dryer, and helps a lot. Put your shampoos and conditioners, body soaps, whatever, that are in your shower. Maybe buy one of those things that hangs over your shower so that you're not bending over to get your stuff. Razors, things like that. But yeah, I'm 16 days post-op. Just saw the doctor. He said my incision looks great. It's about this big. And I'm only taking Vicodin at night, one Vicodin a night, and a Valium for a muscle relaxer, and I'm feeling great. I mean, this was probably the best thing that I could have ever done for me, considering the amount of pain that I was in before I had the surgery. I'd have to say that the back pain after I had the surgery is nothing compared to what I was dealing with for over a year. But I hope that I helped you in any way that I could. And if you have any questions, please message me and I'll try and respond back as quickly as I can and with whatever advice I can give you. And I hope that this video helped you, and I hope that if you're going to be having the surgery that you heal great and nothing happens, and just take it easy for as long as you can, because this is a big surgery and it definitely takes a toll on your body. So but I'm feeling great. I mean, here I am, rocking and rolling. So if you have any questions, just message me and I will respond back, and I hope that I helped you. Alrighty, bye-bye.